To today's Aquila University. We're going to be discussing using SPL. Disclosure, we are recording this session and it will be placed up on our website. If you have concerns about having your question, your answer, and potentially even your name on our website, disconnect now and I will send you an email when it's available for you to view at that time. This is Josh Boutwell, and I founded Aquila Solutions in 2010. Since then, we've been assisting a wide variety of clients, not just with SPL, but with eCTD, regulatory operations, general regulatory consulting, pretty much anything that any problem people approach us with, we've been able to help with. So a quick review of what we'll be discussing today. We'll discuss exactly what SPL is. People use the term but don't really know what it means. We'll discuss who needs to create SPLs. We'll go over a few of the different types of SPLs available. A very brief overview of how you actually submit them. So to watch out for, and of course there will be time for questions at the end. What exactly is SPL? SPL is the Structured Product Label. What this really means is it was designed to allow you to submit your package insert text as an electronic label back in about 15 years ago. Since then, the FDA has found that the basic language, I'm sure that was designed for these labels, is not flexible enough to pretty much any kind of information. And so what they've done is they've extended it to include anything that is, almost just about everything that is information the FDA requires that's not formally part of an application. So, for instance, registering your site every year. Registering just all sorts of sort of little tiny things. The things that 15, 20 years ago you'd send a single form in once a year, now you do it with SPL. Oh, by the way, you still submit your labels. Labels are written in XML. XML is a very generic programming language that is used, a variant of it is used for web pages, can be used for all sorts of things, including eCTDs and, of course, SPLs. Actually, the SPL is based around a series of what are called GUIDs, Global Unique Identifiers. The long strings of numbers separated by periods that are generated randomly. And they're long enough that they are unlikely to be duplicated. By using these GUIDs plus of variables and code numbers, the FDA is able to customize the SPL in just about any way you can imagine. It allows it to accept any kind of data. So it needs to create these things. If in the past you had to submit a form, then you have to submit an SPL. What this really means is if you want to interact with the FDA at all, you'll certainly have to submit some sort of SPL. There are a few very rare exceptions, usually third-party consultants and things like that, but they're few. And the more common examples are, of course, if you have a marketed product, you're some sort of importer or are an agent of someone, in those cases you have to submit an SPL to formally alert the FDA of the information you're submitting. Now, there are lots of types of SPLs. There were 30 types the last time I counted, probably a lot more now. This is because, again, SPL is based around a list of tables. You document that has a list of values in it and some codes. And all you need to create a new type of SPL is create a brand new document. It's very simple. And you have a very, very low risk of breaking anything else. So it's easy to add stuff without worrying about interfering with things that are currently working. Most common is a labeler request. It is the formal request for a labeler code, establishing your registration, as we had talked about, and, of course, product labels. So a labeler request allows you to get a new NDC code for your product. Before you can submit a label, you must have an NDC code to attach to that label. So this is really how the SPL links your label to your drug application. Part of the label includes, if it's NDA, your application number. If it's a monograph, it has the part number. This is how it does that. This is how it connects each label to your product. Establishment registrations, and at last count there were 19 different types of establishments you can register. These are some of the more common types. If you are acting with the FDA, you check this list very carefully. You need to make sure you're not on there, or even remotely on there, or else FDA will eventually come by and ask you about and probably fine you, and potentially your clients or your products could be prevented from import. It could be stopped at the border. Could be even have facilities shut down. All sorts of legal actions that you just really don't want any part of, because you didn't register your facility. So product labels. These are, again, the traditional labels. These are package inserts that are converted to an electronic format. The thing behind this, it allows, number one, for the public to easily access any package insert for any product. And it is very useful safety-wise. But it's also extended to include the actual chemicals, encoding of the chemicals, as well as the various manufacturers that are involved in manufacturing that product. Now, most of the time, this information is not directly shared with the public. However, FDA has it, and this allows them to have a huge database of all sorts of drugs and combinations that allows them to have the possibility of detecting some sort of safety issue faster than anyone else can, just because they have access to all this information. Knowing your product label, you want to look as much as possible like your approved label. It's possible because the SPL, the actual encoding of the label, uses HTML and XML, which is less flexible than printing. You can usually get pretty close. also have to include, again, details of your API, excipients, and images of any containers, of any labels, as well as any packaging that you have on your product. As I said, these are available for the public. In fact, here's the page. You can go through, download all of them. I don't recommend it. It's a big download. Or you can do searches by API, by drug name, by company name, by application number, all sorts of stuff. How do you do an SPL? You're a new company. You know what's going on. All you know is that someone told you have to do one of these SPL things. It can take time. So step one is you need to set up a gateway account with the FDA. Now, you can outsource this, but I strongly recommend every sponsor set up their own account. The gateway is the equivalent of having a FedEx account. You certainly outsource someone slapping your submission in a FedEx box and mailing it. But why? No real purpose to it. As SPL and eCTD advance, there's going to be some communication back through the gateway that you would need access to. So generally, set up a gateway account. Next, you have to request a DUNS number. This is Dun & Bradshaw, a fairly straightforward process. You submit a form and you enter your company name and contact information, and they verify you're an actual operating company, and they'll issue you a number. After you have a gateway account and a DUNS number, you create your establishment registration. This is a very simple registration. It is your address, primary contact information, including your agent if you're an international firm, as well as what type of firm you are. A manufacturer, are you a labeler, etc. Then, after all of that is done, you create your, you get to do an NDC labeler code request. Now, the establishment registration usually takes a couple of weeks to verify. You send it in, and they send you back a number, and then you send that number in, and now you're all registered. That can take up to about 2 weeks. With the NDC labeler code, which you've got, it can take 2 weeks. Once you have that, you select your labeler code on your SPL label, and you can create your SPL and send it in. So really looking at about 4.5 months from the time that you realize you need an SPL to the time you can do it yourself. If you want to outsource it, you can get it down to maybe a month. It depends how prompt they are responding with the establishment and NDC labeler code request. There's some things to watch out for. One, the FDA is very bad at validating SPLs prior to submission. There's a specific reason for this. SPLs, as a matter of security and just to ensure that everything is connected correctly, have a lot of hidden coding that will in the document but aren't available publicly. And the only way to check they have the coding correctly entered, is to do it. If it's correct, it'll be accepted. If it's correct, rejected, and you have to create a whole new version of the SPL with those corrections implemented. Sometimes they'll give you all the errors at once. Sometimes they're really bad about only sending a couple, 1 or 2 errors at a time, which can get incredibly frustrating. I mentioned the GUIDs in the past, the Global Unique Identifier. One of them is a set ID. It is the number that identifies this label and all of its follow-up versions. If it changes or if you lose it, resubmit your label from scratch. There's no way to regenerate it. So be careful to keep copies of what you submit. Registration up to date. If your registration gets too far out of date, the gateway will refuse your labels. Keeping the registration up to date is very easy. Once it's in there, it takes an hour to update once a year. Now, brand new product labels. I generally recommend you expect to take 10 to 12 hours. This is primarily for making sure you've got the formatting correctly entered, and your end result label looks like your actual package insert. Of course, Aquila can help. Well, I said we've done a large number of SPLs. They aren't a problem. Most of the labels, including brand new ones, can usually be completed same day. Sometimes it's next day. And then if you need assistance with setting up a gateway account, or if you in-source an SPL publishing system, we can assist with that. Are there any questions?
No.
Yes. Hello?
Hi, sir.
Yes, I can barely hear you.
Hello?
Can you please type any questions in the chat bar? That should help. Now, questions, please feel free to ask. You can type it in the chat bar, or email, or call me. I hope you can make the next Aquila University, which will be in 2 weeks on April 8th. We'll be discussing security and your eCTD. So what are some of the technical requirements of eCTD in order to have them work correctly? We'll talk about what type of employee needs access, and we'll look at some of the things you might want to do to make eCTD work inside your company's process. Again, thank you for attending, and if you have any questions, please feel free to email me at any time.